Sponsored by RxCardClub.com. Get a free prescription drug card and save up to 85% on prescription drugs. RxCardClub.com. What is the difference between Vemlidy and Viread? Vemlidy, Tenofovir alafenamide, and Viread, Tenofovir disproxil fumarate, are antiviral medications marketed by Gilead Sciences. Vemlidy and Viread are both prodrugs of tenofovir, which means that after they are taken they are converted into the active drug tenofovir in the body. But there are some differences between the two drugs in the following areas outlined in the table below. Vemlidy Viread. Active ingredient: tenofovir alafenamide fumarate. Tenofovir disproxil fumarate. Generic versions available: no, yes. Used to treat chronic hepatitis B virus, HBV, infection in adults and pediatric patients 6 years of age and older and weighing at least 25 kilograms with compensated liver disease. Chronic HBV in adults and pediatric patients 2 years and older weighing at least 10 kilograms, plus. HIV-1 infection in adults and pediatric patients 2 years and older weighing at least 10 kilograms, FDA approved in 2015. 2001. Dosage form: tablet, 25 mg, tablet, 150, 200, 250 and 300 mg, oral powder, 40 mg per 1 gram, dosing schedule: 125 mg tablet taken once daily with food. Renal impairment: Vemlidy is not recommended for use in people with estimated creatinine clearance, CrCL, below 15 ml per minute who are not receiving chronic hemodialysis. Vemlidy is administered after hemodialysis. Patients weighing at least 35 kilograms, 1 300 mg tablet taken once daily with or without food. Patients weighing at least 17 kilograms, 1 150, 200, 250 or 300 mg tablet, based on body weight, taken once daily with or without food. Patients weighing at least 10 kilograms, 8 mg/kg oral powder, up to a maximum of 300 mg, taken once daily with food. Renal impairment: CrCL 30 to 49 ml per minute, 300 mg every 48 hours. CrCL 10 to 29 ml per minute, 300 mg every 72 to 96 hours. Hemodialysis: 300 mg every 7 days or after about 12 hours of dialysis. Mechanism of action: how it works. HBV nucleoside analog reverse transcriptase inhibitor. HBV reverse transcriptase inhibitor. Plus. A nucleotide analog HIV-1 reverse transcriptase inhibitor. Side effects, adverse events. The most common, 10%, all grades, adverse reaction is headaches. The most common, 10%, grades 2 to 4, adverse reactions in adults with HIV-1 infection are headaches, rash, diarrhea, nausea, pain, depression and asthenia. The most common, 9%, all grades, adverse reaction in adults with HBV infection and compensated liver disease is nausea. The most common, 10%, all grades, adverse reactions in adults with HBV infection and decompensated liver disease are abdominal pain, nausea, insomnia, pruritus, vomiting, dizziness and pyrexia. Efficacy: Vemlidy and Viread are similar in terms of their effectiveness. However, Vemlidy achieves similar results to Viread at a dose less than 1/10 that of Viread. Vemlidy has greater plasma stability, enabling it to deliver tenofovir to hepatocytes more efficiently. Warnings and precautions: Vemlidy is effective at a lower dose than Viread, resulting in less tenofovir in the bloodstream and improved renal and bone laboratory safety parameters compared with Viread. Immune reconstitution syndrome and bone loss and mineralization defects have been observed in patients with HIV-1 infection. Drug interactions: known or potentially significant drug interactions include anticonvulsants including carbamazepine, oxcarbazepine, phenobarbital, phenytoin. Antimycobacterials including rifabutin, rifampin and rifampicin. St. John's wort. Drugs that inhibit Pglycoprotein and BCRP, breast cancer resistance protein, may increase the absorption and plasma concentration of Vemlidy. List not all inclusive. Both Vemlidy and Viread are primarily removed by the kidneys, and the elimination of these drugs may also be affected by taking other drugs that reduce renal function or are eliminated in the same way. Known or potentially significant drug interactions include didanosine, HIV-1 protease inhibitors including atazanavir, lopinavir/ritonavir, atazanavir/ritonavir, darunavir/ritonavir. Hepatitis C antiviral agents including sofosbuvir/velpatasvir, sofosbuvir/velpatasvir/voxilaprevir, ladipasvir/sofosbuvir. Both Vemlidy and Viread are primarily removed by the kidneys, and the elimination of these drugs may also be affected by taking other drugs that reduce renal function or are eliminated in the same way. Special patient populations. Liver impairment. Vemlidy is not recommended in people with decompensated, ChildPugh B or C, hepatic impairment. Related questions: what drugs are contained in the HIV treatment Delstrigo Truvada versus Descovy? How do they compare for HIV and PrEP? What is the difference between HIV treatments Odefsey and Complera? rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.